Hey everyone, it's Rob from Treehouse Recovery, and today we're going to talk about something that's crucial for anyone considering their path to recovery: getting off Suboxone. If you or someone you know is looking for help getting off Suboxone, this video is for you. In the first part, I'll give you practical steps to taper off Suboxone safely and effectively. Then I'll dive into the science behind Suboxone, how it works, why it's used, and why it's important to understand its effects when planning to quit. This full breakdown will give you the knowledge you need to make informed decisions about your recovery. Getting off Suboxone. First, talk to your doctor first and foremost before making any changes. Consult your healthcare provider. They'll help you create a tapering plan that's personalized to your needs. Going cold turkey is not recommended. It can be tough on your body and mind, and it increases the risk of relapse. Now, I know there are a lot of people out there that are getting their Suboxone from the street and may not have a doctor. I'd highly recommend speaking to a professional to figure out what's the best route for you. And remember, be honest. They're here to help. Taper slowly. The best way to quit Suboxone is by gradually reducing your dose. This process, called tapering, helps minimize withdrawal symptoms. It could take weeks or even months, depending on the current dose and how long you've been using it. If you want to speed things up, a medical detox facility can help with a faster but controlled taper. Be ready for withdrawal. When reducing your dose, withdrawal symptoms are common. These might include fatigue, irritability, cravings, and body aches. Symptoms can vary, but tapering slowly can ease the intensity. Stay in touch with your doctor if things get rough. They may need to adjust your taper or recommend other treatments. Stay active and eat well. Taking care of your physical health is key during this time. Eating nutritious foods, staying hydrated, and exercising regularly, even walking, can help boost your mood and reduce stress. Get support. Recovery can be tough, so don't do it alone. Whether it's family, friends, or even support groups, having a support system will make a big difference. Therapy can also help, especially if you're dealing with emotional issues tied to your addiction. Be patient. The process of quitting Suboxone is different for everyone. Don't rush it, and be patient with yourself. Setbacks are normal, and they don't mean failure. Keep your eye on the long-term goal: living free from Suboxone. What is Suboxone? Suboxone is a prescription medication used to treat opioid addiction. It contains buprenorphine, which helps reduce cravings and withdrawal symptoms. It was developed in the 1960s as a safer alternative to morphine, and naloxone, which blocks opioid effects and prevents misuse. Suboxone, combining buprenorphine with naloxone, is used to stabilize people going through opioid detox to reduce misuse and addiction risk, reduce craving, and prevent relapse, especially people addicted to heroin, Oxycontin, or fentanyl. Why is Suboxone addictive? Even though Suboxone is less addictive than other opioids, it can still create physical and mental dependence. Here's why. Mild opioid effect. Even though Suboxone is less addictive than other opioids, Suboxone provides a mild opioid high due to the buprenorphine, which partially activates opioid receptors in the brain. Over time, the body gets used to it. This leads to dependency. Risk of misuse. While Suboxone is designed to be less addictive, it's still possible to misuse it. People may try to abuse it for a mild high, but this often leads to dependency. Side effects and risks. Suboxone comes with side effects and risks, even though it's generally safer than other opioids. Common side effects include headaches, nausea, constipation, drowsiness, sweating, and trouble sleeping. Many of these improve over time as your body adjusts. Risk of dependency. If you take Suboxone for a long period of time, you may develop physical dependence. When you stop taking it, you could experience withdrawal symptoms similar to those caused by other opioids. Potential for abuse. Even though it's designed to prevent misuse, some people still abuse Suboxone. especially by injecting or taking higher doses than prescribed. This increases the risk of addiction. Overdose risk. Although rare, overdosing on Suboxone is possible, particularly if combined with other depressants like alcohol or benzodiazepines. Overdose symptoms can include slow breathing, confusion, and even loss of consciousness. Impact on liver health. Suboxone is metabolized in the liver, so those with liver problems should use it cautiously and under close supervision. Suboxone withdrawal. When you start tapering off Suboxone, withdrawal is a concern. Here's what you need to know. Physical symptoms. As the drug leaves your system, you may feel fatigue, achy, or even nauseous. Sweating and the chills are common too. Psychological symptoms. Anxiety, irritability, and depression may come up, especially if you've been on Suboxone for a long period of time. Some people experience intense cravings. Duration. The withdrawal process can last anywhere from a few days to a week, depending on your dose and how long you've been using Suboxone. If you're struggling, talk to your doctor. They can help manage the symptoms. Why get off? Suboxone, when used properly, has done wonders for harm reduction, helping people detox, getting opioid addicts away from dangerous street drugs such as fentanyl. Unfortunately, we often see people begin to misuse Suboxone or use it as an easy way out. You have to remember there's no magic pill for addiction recovery. We have seen and treated so many people who started on Suboxone as a safer alternative, did no further work on themselves, ended up becoming dependent on Suboxone for upwards to multiple years. These people report symptoms like an inability to feel emotions, the lack of being present in the moment, and isolation. You can't let Suboxone be your only saving grace. To get a life of your dreams, it requires multiple ingredients. Now, if you stopped using street drugs, that's a huge step in the right direction. But getting off Suboxone to improve your quality of life and reaching the standard you're capable of, now that will be the most rewarding feeling, one that will ensure your sustainable recovery. Getting off Suboxone is a personal journey and it's not always easy, but it's possible. With a solid tapering plan, support, and patience, you can successfully transition to a life without Suboxone. Remember, don't rush the process and always consult a professional. Stay focused on your end goal and be proud of every step forward. If you're in recovery or just beginning, you're not alone and help is available. Thank you for watching, and don't forget to like, comment, and subscribe for more addiction and recovery videos. This is Rob from Treehouse Recovery saying stay strong and take care.